This is a short video on circle of Willis. It is a first video for that of the blood supply of the brain. In the first video, I will tell you about the circle of Willis and some of the factors which leads ultimately to that of the cerebrovascular accident. What are the condition which may lead to these cerebrovascular accident, that I will also explain in this short video. And after that I will go in the next video, I will explain you about the central arteries of the circle of Willis, which will supply to the deeper structure of brain, say for example internal capsule, and what will be the effect of the occlusion of some of the vessels of central arteries. Okay, the third video will be on the cortical branches, which will supply the gyri and sulci of the cerebral cortex, okay, on all the surfaces with the help of the three cortical branches: anterior, middle and posterior cerebral arteries. And in the last video I will explain you about the blood supply of the brain stem and the cerebellum, and ultimately I will also tell you in the same video about the blood supply of the spinal cord with all clinical correlation. So let us come to this first video that is meant for the circle of the Willis. I am moving to the next slide to tell you about the formation of the circle of the Willis. Now in this formation of the circle of Willis, two sets of the blood vessels are involved, okay, and these two sets of the blood vessels are, the one set is the vertebral arteries, right and left vertebral arteries, and second set of the arteries, right and left, okay, internal carotid artery. Thus this right and left vertebral artery and right and left internal carotid artery will ultimately form what is called as the circle of Willis. But before formation of circle of Willis, this will give also many branches. Okay, now let us see how the circle of Willis is formed. Now see the first set of the arteries, that is right and left vertebral arteries. Now this is a vertebral artery which is taking origin here from the subclavian artery. As a branch of subclavian artery, it ascends and then passes through the foramina transversarium, okay, right up to the foramina magnum. Now this foramina transversarium are the foramina in the transverse process of cervical vertebrae on right and left side, okay, and this vertebral artery then passes first through that of the foramina of the sixth cervical, then fifth, then fourth, then third, then second, and ultimately then it comes out through the foramina of the first cervical vertebrae or the atlas. Same is true for the opposite side. So the right and left vertebral artery, after coming out through the atlas vertebra, they penetrate the dura and arachnoid matter, and then they go into the subarachnoid space, okay, through the foramina magnum. So they are now through the foramina magnum, they have come to the cranial cavity, where right and left vertebral artery will join to form what is called as the basilar artery, and this basilar artery will lie on the clivus, which is a sloping part of the basis sphenoid bone, and then at the upper border of the pons, this basilar artery will divide into the two terminal branches, that is right and left, okay, this posterior cerebral artery. Let us see this vertebral artery in this diagram, and this vertebral artery, after piercing the dura and arachnoid, has come on to the anterolateral aspect of the medulla. It has come, and then this is the the right basilar artery, right vertebral artery, and this is the left vertebral artery. They are lying on to the medulla oblongata, and then when the lower border of the pons will approach these two vertebral artery, they will unite to form a single artery, what is called as the basilar artery, and this basilar artery will lie into the pontine sulcus, which is on the ventral aspect of the pons, and then this basilar artery will run right up to the upper border of the pons, and in the upper border of the pons it will divide into the two terminal branches, that is the right and that of the left posterior cerebral artery. Posterior cerebral artery. Now this right and left posterior cerebral artery, at this point they are within the interpeduncular fossa. They are within the interpeduncular fossa, which is on the ventral aspect of the midbrain, and the structures of hypothalamus posterior to the optic chiasma, and this is the optic tract is here, and here will be, which is not seen in this diagram clearly, are the crus cerebri, which are the part ventral aspect of the midbrain. This forms a fossa here, what is called as an interpeduncular fossa. The subarachnoid space is here. Subarachnoid space is here. In this, these arteries are lying. Let us come to the second set of the arteries, and this is the internal carotid artery. Now this is the internal carotid artery takes origin here. I mean not internal, I mean to say common carotid artery, okay, and then it divides into the external and internal carotid artery, external and internal carotid arteries. Now this is the internal carotid artery, okay, after its origin from the superior border of the thyroid cartilage, it will run upward towards the base of the skull, and at the base of the skull there is an opening of the carotid canal, which is called as the lower carotid, I mean say lower opening or inferior opening of the carotid canal, and then this artery will pass through the carotid canal to come into the cranial cavity through the upper opening, okay, superior opening of the carotid canal. Then this artery will lie first on the superior surface of foramina lacerum, and then soon it will enter into the carotid sinus, where it will lie into the carotid sinus. After the carotid sinus, then it will pierce the dura mater and arachnoid matter, okay, medial to the anterior-clinoid process, and then after this it will come into the subarachnoid space, okay, subarachnoid space, where it will divide into two terminal branches, what is called as anterior cerebral and the middle cerebral. This will be same on through the opposite side. Now let us see the formation of circle of Willis with the help of the two vertebral arteries, I mean to say the pontine artery here, we can say it here, this is the, I mean to say not pontine, basilar artery which lies on the pons, and this artery is the internal carotid artery. Excuse me. This internal carotid artery lies on to the here in the internal peduncular fossa, okay, after piercing the arachnoid and the pia mater. Then this artery will run laterally in the stem of the lateral sulcus, where it will divide into two terminal branches. One is called as the anterior cerebral, this is smaller one which you are seeing on the right side as well as on the left side, and this continuation of the internal carotid will be that of the middle cerebral artery. So anterior cerebral and the middle cerebral artery is here, okay. So these are the terminal branches of the internal carotid artery, okay. Now let us see the formation of the circle of Willis. Here posteriorly, after the bifurcation or in the terminal branches of the pontine artery, okay, I mean say not pontine, I am sorry, the basilar artery which lies on pons, these are the right and left cerebral, posterior cerebral arteries, posterior cerebral artery, and this is the internal carotid artery. Now there is a communication between the internal carotid artery and posterior cerebral artery with the help of a connecting link are anastomotic arteries, which are called as the posterior communicating artery. This is called as the posterior communicating artery. And then this artery, internal carotid artery, here it gives a branch what is called as anterior cerebral artery on right and left side. Okay, and this anterior cerebral artery, they run forward. Okay, and here when they come close to each other near the median plane, okay, then they are interconnected by another artery what is called as the anterior communicating artery. So the internal carotid artery, the posterior cerebral arteries and the anterior cerebral, they are interconnected with each other and they form here a hexagonal, okay, arterial arcade, or the circle type. Though it is hexagonal, it is called a circle. So this is the circle of Willis. Now the location you should note of this circle of Willis, it is in the most of its part is in the interpedunculaire fossa. Now I will show you a theoretical diagram of this hexagonal circle of Willis. See this. This is the circle of Willis, okay, where this circle of Willis, as I said, it is because of the posterior cerebral. This is the right and this is the left posterior cerebral. This is the posterior communicating artery which is arising from the posterior cerebral, and this is the internal carotid artery on right and the left side. Okay, now this is dividing into two terminal branches, internal carotid. This is the anterior cerebral from right and left, which are joining each other in midline by an anterior communicating artery. And then this internal carotid artery seems to be a continuation in the form of the middle cerebral artery. So this is middle and this is anterior, which are considered to be two terminal branches of the internal carotid artery. Okay, thus a hexagonal circle of Willis has formed here. Okay, so you can see very well. So anterior communicating artery lies above that, I mean say anterior to that of the optic chiasma, and here it is the posterior communicating artery. They lies on the sides, okay, and they are connecting the internal carotid with that of the posterior cerebral artery. So this is how the circle of Willis is formed in the interpedunculaire fossa. Now let us see the branches of the circle of Willis. Now the circle of Willis gives mostly the branches which are called as the central branches. What you are seeing here, these are the branches. See where it is PM is written, and these are the branches where it is AM is written, and some of these branches which are also considered as the branches from the circle of Willis, though they are not directly taking origin from circle. For these anterolateral branches which is taking origin from middle cerebral, and this is posterolateral branches which are taking origin from the posterior cerebral artery. Okay, so these are anteromedial central branches, this is the posteromedial central branches, this is anterolateral central branches, and this is the posterolateral central branches. Now these central branches are multiple very thin branches, and they penetrate the substance of the brain on the ventral aspect, anteromedial and anterolateral on either side, okay, right and left side. They will penetrate the anterior perforated substance, and that's why that is called as perforated, because this area is perforated by the anterior cerebral artery. Similarly, the posteromedial and posterolateral on either side, they perforate an area of the brain on its ventral aspect, that is called as posterior perforated substance. And this central artery, they go deep to supply the deeper structure. For example, they supply thalamus, hypothalamus, internal capsule, the lentiform nucleus, the caudate nucleus. So these deeper important structures are pierced, I mean say not pierced, by supplied by that of the arteries. Okay, these are the central arteries. Let us come to the I mean to say, importance of this circle of Willis. Okay, as you must have understood by this time that this circle is formed and anastomosing arteries are there because in case of blockage of any artery, say it may be pontine, say any of the internal carotid artery, okay, if it is blocked, okay, then there will be the blood will bypass through this circle, okay, and all the parts of the brain will get the blood, okay, there will be no problem, and that is the basic function of formation of the circle of Willis. Not only if it is blocked at a, I mean say at a level of internal carotid artery, okay, or in the level of the vertebral or pontine artery, but if it is the blockage here, see for example, here it is the blockage of the subclavian artery, okay, it is the left subclavian artery is blocked just before just above its origin, I mean say above the origin of it from the arch of the aorta. See this thrombus means a blockage, a blood clot, it is thrombus which may form here or which is, I will just explain it to you in next slides. Then what will happen that this art, I mean says left subclavian artery will get its blood from that of the, it will first go into the right vertebral artery, then from the junction between the right and left vertebral artery at the lower margin of pons, and this is the basilar arteries here, okay, in front of the pons, this blood will bypass here to the left vertebral artery, and then it will go to the rest of the places. That means in the subclavian artery, to its all branches, then it to the axillary artery, and thus lower limb will be saved. Okay, so not only those intracranial branches, okay, where the bypass will take place, but it is the bypass which may also take place if a subclavian artery is also, because it will be bypassing from one vertebral artery to the I mean say of one side to that of the other side of the vertebral artery. Okay, let us, this central arteries about which we are talking, we are not talking about cortical branches which will take origin from anterior cerebral, middle cerebral and posterior cerebral artery. So many branches will, and they will supply the cerebral cortex. We are not talking at present. Okay, I'm talking at present about the central arteries, anteromedial, anterolateral, posterolateral branches. Now these arteries which are perforating to the anterior substance, okay, and the posterior perforated substance, okay. So these arteries are very thin, small, okay, central arteries, and when they penetrate this in the substance of the brain, okay, they do not anastomose with each other at the arteriolar level. Arteriolar level means, okay, arterioles will ultimately form the capillaries. So just before formation of the capillaries in other places in body, there is a general rule that these arterioles will anastomose with each other, okay, anastomose. That is the precapillary anastomosis. Thus this precapillary anastomosis, it doesn't take place in the central artery. What does it mean? Thus the central arteries are the end arteries, and end artery means where anastomosis is not there, and if central arteries at the arteriolar level are blocked by thrombus, blood clot or anything are ruptured, then the area supplied by that central artery will not survive, it will die, so the brain tissue will die. So that is the meaning of that the central arteries are end arteries, and that is the importance of this artery in the deeper blood supply. But in case of the cortical branches, anastomosis is very profuse, okay, with that of the branches of the neighboring arteries, okay, on the surface of cerebral cortex. So if a branch of these cortical arteries is blocked, the blood will bypass and now let us see how the vascular lesions they takes place, okay. The vascular lesions may occur, okay, due to the following conditions, which if there occlusion, that means there is a blockage, okay, occlusion. And why this blockage will take place in an artery? Either it is the vertebral or the branch of the cerebral, or I mean to say the internal carotid artery. Okay, this may take place by three different mechanisms, okay, which you will learn in your higher classes definitely in a great detail. But this is number one condition is atheromatous degeneration. That means there is an swelling, I mean say deposition of cholesterol deep to the epithelial layer, endothelial layer, and then the swelling keeps on growing and it completely occlude or block the artery. As you must have heard that in the coronary artery there is the occlusion takes place, so that block takes place. So right coronary or left coronary gets blocked, so the blood is not going to the heart muscle, and this leads to, in a layman's term, what is called as the heart attack. Okay, it leads because the blood is not available. Similarly, these vessels which are supplying to the brain, okay, they are in similar way also, so the degenerative changes, what is called as atheromatous degenerative changes, which may lead to the blockage, okay, blockage of the, and this condition is called as cerebral ischemic disease. Ischemia means stoppage of the blood supply or less blood supply, okay, so of a particular tissue to which the artery is going. So this is called as cerebral ischemic disease. The first reason is the atheromatous degeneration takes place, or there may be the formation of the blood clot, okay, and this blood clot is called as thrombus, okay, and this blood clot may be big, so that the very less blood is passing, because in the lumen the is occupied by the blood class. Here is the condition where blockage is there due to the atheromatous degeneration. Here is the partial blockage is there, and then this blood clot may break in small pieces. Okay, what is blood clot? It is nothing but the blood, coagulated blood, and this may break in small pieces, and these are small pieces are called as thrombi, and these thrombi, when they float into the blood vessels, okay, they are known as emboli or embolism. So because of this, this thrombi or embolus, these emboli are very fine particles which will go and end into, will be blocked by the very fine capillary arterioles, okay, so the blood will not go beyond that thrombus, okay, beyond that where the blockage will take place by three different mechanisms, okay, three different. Now let us come to another mechanism that is called as the vascular lesion of CNS, I'm to say, and another mechanism of vascular lesion or ischemic, cerebral ischemic lesion. The vascular lesion may also occur due to hemorrhage, that means rupture of the blood vessel, and rupture of the blood vessel may be due to the high blood pressure. You must have heard that a person was having high blood pressure and his blood vessel ruptured, so he got what is called as a stroke, cerebral stroke, okay, and body was paralyzed on half of the side, okay, one half. Okay, so this is the rupture of vessel, which is the important cause is the high blood pressure. Then degenerative changes, we already learned the degenerative changes in the wall of the blood vessel may also rupture. It may also, though the blood pressure may be normal, or with the high blood pressure, that rupture will be more quick, okay, from the degenerative changes. And then third condition is the aneurysm. You can see here in the circle of Willis, lot of this but cherry-like structures are seen, and these are nothing but the dilatation of the blood vessels, and they are attached with a pedicle on the side, okay. So these blood vessels here, where this thrombus, this aneurysm, they are called as aneurysm, and so many aneurysm can arise, especially in the close part of the circle of the Willis, that means lower part of which blood vessels which are from deriving from the posterior cerebral or the posterior communicating artery. So aneurysm may also rupture, because it is thin walled. Okay, it is not as thick as the blood vessel, cerebral blood vessels, and this will be rupturing, and rupture of the blood, okay, I mean say blood vessel will lead to the effusion of the blood will come out, and it will start accumulating in the neighboring areas of the brain, in the neighboring where the rupture has taken place. This condition is called as hemorrhage. Hemorrhage means bleeding after rupture of the blood vessels. Okay, hemorrhage leads to the escaping of blood, which destroys the brain tissue. When the blood will come out, say for example here the blood has come out and this blood has diffused, okay, into the tissues, and this will destroy the brain tissue in surrounding areas. Okay, thus its effects are widespread. Why its effect? Because then it will destroy this large area of the brain. Okay, large area. While occlusion, if the blood vessel is occluded, small blood vessel is occluded or blocked, then because of thrombosis or embolism, then the only a little area will be affected. But when the blood vessel rupture, a large area will be affected. Okay, because the brain tissue will die in that area. This completes the first video on to the this blood supply of the brain, and I have told you in this the formation of the circle of Willis and the central arteries and some of the, I mean to say, factors which leads to the vascular lesion in the central nervous system. Now we will come to the vascular region from area by area. Okay, now let us go. I think this completes the this